study, we do professional studies. We are like doctors. We think initially while we are in medical school and all, practical thing, what is happening at our place and what we are learning is quite different. And we will have so many aspirations, all those things. You have all gone through all these things, and some of you may be knowing that it is not worth to spend so much of time, or there is so much pressure on doctors nowadays. So now the time has come for the doctor to introspect himself. What exactly we are doing? We will be completing our practice. We will be blaming each and every person, and then finally we will become a. We are not nor here nor there. We are intellectual, but we are not satisfied. We are doing our duties, but we are not happy. We are not at peace. So finally, whatever we are taking from here, we are not taking anything. We are leaving everything. I have a habit of asking all my seniors or any senior in my life who crossed 70 years. Since childhood, I have this habit. I ask them, if you are given a chance how to relive, will you relive the way you are, or you will change somewhere? So finally, everybody at around 60 years, they will understand what life is. When I went into meditation, everybody asked, like my friends, they were wondering, I am a meditation teacher. I'm like, I never used to go to any temple in my life. I used to stand in front of the temple. My wife used to go inside, pray and come. I never used to go into the temple. That sort of logical personality never thought of anything else than medicine profession, because my second generation I've seen my father and mother toiling. They started their hospital in 1967. That time ambulances were also not there. So many patients my father used to take in the car for labor and all. If they ask for, they used to go to villages and all. So much effort we take as a doctors, but we don't have that much of satisfaction in our hands. Everybody knows this, nobody talks about this. Everybody goes for some resort or some cycling or trekking, or it is all temporary. You are not happy from inside, from morning to evening, you are not happy. I usually think that how many years I will be staying here, living here on the earth, calculate in months, how many months we are here on the earth and for what we have come here. So suppose if I say that I will be active till 70, how many months? You will be surprised that we are just for some time being. We never knew that corona like thing will come, or there will be lockdown like thing. Once again it is coming, and so much of stress, so much of uncertainty. So I started this journey from 2002 or 3. I was working in Tata, I was in Bombay, Baba Hospital. Then I saw cancer patients. Everybody was suffering. One patient asked me in OT, we had done him pneumonectomy, left sided pneumonectomy, lung we had taken out. Night 1:30 or something, I got a call that patient is calling you, he is feeling breathless. Then I went attended him. The patient is asking me, sir, sorry to disturb you at night. I have one question. He told, sir, मरते वक्त दर्द होता है क्या? So I was wondering, we are putting people in ICU and nobody is visiting their near dear ones there. And how they think when they are on the bed? If I am on that bed, how I will be? Now I am doctor, fine. You never I will also get sometime. Any problems? How I will be, how I will behave. That that day I realized that we are not considering feelings or emotions of the patient. Then one superintendent of police, stage 4, prostate metastasis in vertebra, could not sleep, could not sit. He should be in 30-degree position only whole day. Nobody used to come to meet him. When he was superintendent of police, you imagine how his ego would be, how everybody would be saluting. Now he is crying. So then I thought, this all whatever is seen is so much of an illusion. By the end of life, when we realize, then we cannot go back. So then one day we were just seeing how to so much of medicine has grown, but suffering has increased for patient as well as doctors. I used to fight with my medical oncologist colleagues and radiotherapy colleagues. I stopped doing esophageal surgeries in 2008 so or something, because whatever we operate or do, they will survive for 1 more year. That too, 6 months they will be in hospital. Some leak here, some leak in the chest, or post radiotherapy complication or chemotherapy complication. I thought let them die at 7 to 8 months with their loved ones rather than being at hospital. So I used to call every time when there is a tumor board meeting. Every Thursday we used to have a tumor board meeting where all specialties of onco will meet and radiologist also will be there. So we discuss what is the protocol to be done to that patient. So then I realized, this all we are doing हाथ को साफ करने के लिए. सर्जन हूँ, काटना है, मेरा धर्म है, मैं काटूंगा. मेरा हाथ खुला होने के लिए मैं काटूंगा. पर फाइनली मेरे घर में किसको हो रहा है तो मैं क्या समझूं? What I will think. So then I started seeing all these things. One fine day in 2008, my wife was seeing a program called Awakening. B.K. Shivani, she is a computer science expert. She has a software company also, you must not be knowing. The 20 minutes program was there. In that program, she mentioned that they did a study on 3,000 cardiac patients who were not in a position to get operated because of their elderly age or their comorbidities or because of financial reasons. So then she told around 70% of patients, they could heal or cure 100% clot which was there, 90% whatever, it got dissolved for 70% of patients. I was shocked, what these people are doing. 70% of people in 100 who has clots within 1 year, after doing meditation and lifestyle changes, if they can clear that, then it is a miracle. There was a number scrolling down there. I noted that number, next day I called. So then they told, no, every year we will have a meeting of doctors. Please come, whenever meeting is there, I will call you. Every month I used to call them. Don't forget I am coming, I want to come. I want to see your patients. I went there, I saw those patients, angiography reports, I talked to them. Post angiography also saw, met 10 to 15 patients. Then I went for 2 to 3 days, then I thought I postponed. I stayed there. There's a wing called Spark there, where they do research on meditation. We sat there, what are all the books, what are all the projects they have done, I used to sit and read all those things. How cool it is that problem. Because it was very difficult to convince me that meditation will improve health of patient, as we are not taught in our medical school. So then I came back, I started teaching meditation to people. Then I started seeing there are so many changes. Rather than that, I started noticing in my staff telling lies, attrition, and that seva manobhav, it increased in them. They used to feel good working at hospital rather than at home. They used to daily meditate. We used to take class daily 1 hour every day, either me or my wife. For 2 years we continued daily teaching them. Then while teaching, we got transformed ourselves. Once you start teaching, if you do wrong, your conscience will bite you. You will feel no, I should not do because I have told. So commit yourself, and you will feel happy that whatever your staff is there, they are obedient and they like, I mean, it becomes a family that even if anybody asks, even if somebody else pays them 2,000, 5,000 more also, they will not go. Attrition will not be there. Any of their problems we started solving, and now we are a happy family, our staff and all. Everybody knows meditation, they teach everybody meditation. And we started this experiment in IVF cases also. We used to take picture of embryos and teach them meditation and then do embryo picture. We used to see the aura. I have done a degree called consciousness engineering, that is engineering on thoughts. My teacher is Dr. Amit Goswami, he is a nuclear physicist from USA. It's a 2-year degree. So I started researching on thoughts since 15 years. We have started a med lab. Med lab is meditation lab. Whatever parameters changes while doing meditation, we record it. If I tell you just by meditation how your patients, you will be surprised. You would have unheard like that. One lady, in an energy conference we had in Bangalore, every year we have. So one lady from Ladakh came. She was a rheumatoid arthritis. She was on wheelchair since 15 years. She never got up from that wheelchair. For passing stools also, there was a hole in the wheelchair. 1.5 hours we did meditation with her. We told her how are you feeling. One commentary we were giving how to come out of all her feelings and all. She initially told, I am feeling like I am in a deep well. I am not able to, I am very scared at all. Then we told, is there any crack somewhere in the well? Just see. She told there is no crack. Then we told, is there any ant or any rat or anything? It is there or what? Just see. Then she told some ant is going. We told follow it. Our mind won't accept. If I tell you, you will not accept all this. Then she is telling that I am going through the group. She went into deep inside. 10 to 15 minutes she took. Whenever she used to talk, we used to just push her. Then after some time, she suddenly says that I am seeing the white light. I am flying. I am flying all over the sky. I am bird now and all. So we told, yes, you carry on, you fly, you enjoy your journey and all. And after 10 to 15 minutes, we told her, tell her, get up. She got up. She went, we told her to climb the stairs. First floor she went. Her wheelchair was on ground floor. She could see, we told her after 10 to 15, she opened the eyes. She could see that she is walking, not on wheelchair. She came down. She left the wheelchair. She went. So much of emotional blockages are there in every one of us. 99.9% are psychologically unstable. Everybody we think, when we see, if there is a physical ailment, we help them. If there is any problem with their body structure and all. But it is very difficult to identify psychological handicap. What time it happens, what time it doesn't happen. So we should always think that everybody will not be behave like you because he is a different person, he has a different karma, he has different experiences. So now coming to the topic, this is only one question, one experience I told you. There are plenty. I can tell you hundreds. We went to Mount Abu first time in 2008. Morning 3:30 in my lifetime. I think first time we got up in the morning 3 o'clock. And that day 9 o'clock around night, they told us after food we have one hour more class. Morning 3 o'clock we got up, at night 10 o'clock we are attending another class. There were around 400 doctors. So in that only 50 people attended because it was late, everybody was exhausted. Then I told my wife, no, let us see what all they are doing. We will see. And we attended the class. Dr. Chandrasekhar took that class. He is a PhD doctor. He was an ex-army person. He had testicular cancer, stage 4, liver mets, esophageal varices, ascites, hematemesis, and he was on deathbed. Doctor told him that he will not survive more than 15 days. So that day, whole night he saw, sad. He felt that he should do something. He felt that he said that somebody touched him in the night, and there was a conversation with him. And he told, now I will live for whatever your wishes are. I will not live for myself. And then next day he called Brahmkumari sister to the ICU. She taught him a meditation. Within 1 week he was out. After 15 years, he took our class. After 15 years. He is still there. He is teaching meditation to everybody. All these stories won't fit into our mind. We are very logical, intellectuals. So many miracles. So many times I go, my lecture will be there. 2 or 3 people will come and ask me, I have this symptom and all. They would be positive. But next, when I go, they would be, whole of their cancer would go away. So there is so much of miracle. I mean, if a cancer-like thing will go, then any disease we can cure any disease. So then in that class, we were dead tired. 5 minutes meditation, they told, you are all tired, do. They told to take a purple light for energy. Within 5 minutes, we felt so energized. It isn't that environment, where a lot of people meditate. People daily, 20 to 25,000 people meditate daily at Abu. If you go and sit there also, you will go into deep meditation or trance. Just now I came to Vinaka's center. As soon as we enter, we can identify the change in the energy. Any place we go nowadays, we can identify what is the energy. For intuition, for the patient, so many patients, they come, sometimes we feel like to operate or not to operate or what, especially post-COVID and all. We go to meditation, she will also ask me, shall we do or not? Shall we do? Whichever patients we have not done, they have not survived. They went to Hubli, they got operated or whatever, but they did not survive. That intuition develops in our practice, which case to do, which not to do. We will be open people and we will be in a position to select our patients what to do. Unless we are taking headache, and then you can see so many problems are there nowadays. So these all with meditation they improve, and our health also it improves. So I will start with my slides now. As radiotherapy, chemotherapy, surgical therapy, let us see meditation therapy will work or what. You all know these causes of cancer and all, and it's not easy. I want to tell you the psychological causes. These are all age infectious, sunlight, tobacco, obesity, and all. Dietary causes are there, so many. Now, coming to psychology. I, I read so many books on this. I read my father had hepatocellular carcinoma. I was working in Meadows Cancer Hospital that time. Every year he used to get ultrasonography done. In that it was less than 5 millimeter when it was diagnosed. But within 1 year, everything was tried. I tried all the systems, all allopathy, additional systems, everything. From 12 countries, I took the medicines and everything was tried on him. Surgery was done, everything. But within 1 year, we lost him. Then I started thinking, why? What is the problem? That guy was Indian Academy of Pediatrics president for 2 times. Very active person. Daily used to play 1 to 1.5 hours. He used to play hockey. He used to play tennis. He used to play cricket. 2 months back, he scored 68 runs. In lawyer and doctor's match was there at our place. 2 months back, he scored 68 runs and took 4 wickets. He was such an active person. And always used to be, he has so many NGOs, so many things, daily meetings and all. Very busy. Then I realized his one thing that he never used to share whatever problems are there. He used to keep with himself. I started correlating why he got cancer. He never had any alcohol or any smoking, or he never had a betel nut in his lifetime. And morning daily, get up at around 5 o'clock, sleep at around 10 o'clock, ideal lifestyle. But still he got no family history of cancer anywhere. Then I started realizing that because of emotions, we are getting so many diseases. That's why I started reading about the thoughts, why thoughts come and all. So now, we have to consider the emotions and what are all the feelings of the patients. If you address these things, automatically 50% of the ailment will reduce. Like repressed anger, hatred, resentment, post-traumatic stress disorders, war, natural disaster, loss of loved ones, domestic abuse, financial destitution, tragic events from childhood, or the diagnosis of cancer itself. Stress is the main cause that we are not seeing. Depression, isolation, poor sleep, emotional trauma, general drive stress, electromagnetic field radiation. This we are forgetting. Wi-Fi is causing a lot of problems. Now 5G is coming. I don't know. When I started my practice in Haveri in 2004, I used to get one case per week of CS queries. Today I can see almost every day I am getting 100 cases of CS. It is like becoming like a diabetes. So much rampant cancer has become. So radiations are. What happens daily? Every day our bodies are exposed to cancer causing substances, but our immune system is quite strong. It first from invading only it it attacks the DNA can repair and killer T cells kill the cancer cell. When the stress is there, our body's ability to do all these things will reduce. So when emotional physical stress, it loses ability to fight cancer. In chronic stress, what happens? There is an activation of inflammatory response, inhibition of immune response, inhibition of apoptosis, reduction of NK cells, inhibition of DNA repair, angiogenesis increases, and epithelial mesenchymal transition will cause activation and change in the type of cell. Initially, emotional trauma, it affects our sleep, melatonin level decreases, and which is necessary, very much necessary for cancer cell growth. So stress increases the cortisol level, it suppresses the immune system. Individual experiencing emotional trauma, stress, gets exhausted, their adrenal and thyroids get fatigued. Then somatics in our blood, they start to react. They are simple three-stage cells. They shift into six-stage macrocycles. They transform themselves into more and more aggressive bacteria, yeast and fungi-like structures that are parasites to the cell. They start destroying the body cellular structure, that is early stage of cancer. So now there is a stress also causes glucose level to rise in the cells, increased cortisol, reduced adrenal, increased glucose, reduced oxygen intake because the glucose increases, then the cancer patient feels weak and lethargic. Then all these bacteria, they eat all the cells and all. There will be lack of oxygen and they start mutating. And then they finally become tumor. So stress stimulates cancer cell growth and metastasis, increase epinephrine and norepinephrine levels, matrix metalloproteins and VEGF, vascular epithelial growth factor increases, breakdown in the structure of tumor cells, making it easier to spread, and the cancer grows to other places, leading to metastasis. Now, for this, what we should do? In Western, they have a field called psychoneuroimmunology. In 1973, they have started this. Now we are hearing in India. It's a field of medicine that uses process of mind to influence the health of the body. Normally, whole day we will be thinking. A good person means what? He has a good thoughts. A bad person has a bad thoughts or negative more thoughts. So we have our personalities because of our thoughts, and we never take care of our thoughts. We don't know from where the thoughts come. I was wondering from where the thought come, why that thought came to me, and why another thought comes to another person. So I did research for 2 years why that particular thought comes to me, and then it is a reason for the disease. So I will explain. It's defined as behavioral, psychological, social, and spiritual approaches to the medicine not commonly used. They are all types of things: meditation, visualization, affirmations, relaxation techniques, guided imaginary, biofeedback, hypnosis, yoga, everything, music therapy, complementary Ayurveda, Panchakarma, naturopathy, acupuncture, diet, nutrition, everything. So only in this we can say that mind can heal anything if we have the faith. So goal of meditation is journey to discover first ourselves, then the mind and body changes. Emotions. Meditation, how it affects emotions. It reduces the habit of irritability of limbic cells, sustains calmness, non-reactiveness, thus avoids tendency and recurrence of stress reactions. It helps improves the patient's daily activities, decreases anxiety and depression, releases anger, eases stress, grief and fear, fosters inner calm, heals physical and emotional levels, increases feelings of vitality and rejuvenation, happiness, emotional stability, builds self-confidence, and we become more creative, and this leads to inner guidance. This is very much important. This intuition is we develop a lot. Now we will see the emotions of our vibrations. You can see those emotions. 0 is frequency of death, and till 50 there is a guilty, apathy, shame and all. Above that is grief, jealousy, anger, fear, pride. Above that is courage, neutrality, willingness, reason. 500 is love. if we want to heal anybody, they should be vibrating above 480 hertz. That is at the level of love, enthusiasm, happiness, positive expectation, and belief, faith. This from this level above, we can heal anybody. To go to this level, there is no other way other than going to for meditation and become a soul consciousness person. If we are a body conscious, it won't happen. So you try yourself whenever you are ill or you are not feeling at ease. You deliberately try to be in love, joy, peace, enlightenment. Appreciate a lot of people, and there should be gratitude. A lot of people wants to live the doctor's life, but it is not possible for them. It's their dream. So you should have a gratitude that you are a doctor, you are healing so many people. So now onwards, let us be empowered ourselves first and then heal. So that it will be, you will feel like, you will be ecstatic and you feel really good while practicing. You will not have, ಇವನಿಗೆ ಸಾಕ್ತಾನೋ ಅವನಿದು ಮಾಡ್ತಾನೋ ಇವನಿಗೆ politician connection ಇದೆ ಅದೇನಿದೆ ಇಲ್ಲ police ಇದಾನೋ ಅದಿದೆ. You will not think all these things. You will do with your pure conscience and heart. If you feel, if you get intuition that you should not treat, you will definitely get intuitions. Then you can definitely avoid those cases. Above 500, we should be here. So what happens? Meditation improves proper coordination between all the endocrine glands, enhances the immune systems, it restores normal rhythm of endocrine glands, it improves cellular antioxidants, it decreases muscle tension, it is pain and all for the patient. How it helps cancer patient? First, if we say the diagnosis of cancer, cancer agide, just if I tell like this, patient will be half dead first. I remember one patient, he used to come every 6 months to get endoscopy done and direct laryngoscopy done for me. Some guy in periphery told him that he has cancer. He believed that he has cancer. We used to investigate, he used to force us to investigate. We used to investigate every 6 months. First of that month he used to come. Fix January 1st and after 6 months. After 3 years, every 6 months waiting, there was no cancer. But then one day I got a call from psychiatric hospital. The doctor was telling that this patient is saying your name and he has a cancer, he is telling. And he has no skin is that is hard and the skin is shiny. I told them he must have developed just sand. They told it is not possible because he is very violent. Then I told him, give him phone, I will talk to him. He will come back. He came back. We saw he has stage 4 cancer. So, because of his thought, he created those things. A person, just he had a lymph node somewhere because of infective pathology. He told him, you must be having cancer, you just treated. It went into his mind so deep that he got cancer. So first fear, anxiety and confusion at the time of diagnosis. Help to take charge of one's emotions and navigate through the treatment options and lifestyle changes for a speedy repair. A lot of patients related tell, sir, here but cancer is here but. I tell them if you go to radiotherapy or chemotherapy, that cancer hospital board will be there. Anybody can make out. There will be so many operated cases on right tube or operated ear or fistula or anything will be there. So better let me explain them. It will be easier for you to manage them. So then they will take charge of their emotions and they will navigate through the treatment options in a better way. Improves ability to manage stress, find solace within and gain inner strength to deal with serious illness. Provides deep relaxation, calmness, energy, intuition and clarity of mind to face the challenges for fighting of his own life. Reduce emotional psychological stress which are known to contribute to the onset and progression of the cancer. So there are so many things. I will tell you some studies. These are all the neurochemical changes during meditation. Here, norepinephrine and cortisol are decreased, and vasopressin, GABA, melatonin, serotonin, all are increased. Endorphins also during meditation. DHEA is a determinant of physiological age and resistance to disease. It increases by 90% due to meditation. Melatonin, which is a powerful antioxidant, improves it by almost 300%. Cortisol declines by 47, almost 50%. Endorphins, they produce analgesia. So this in turn helps patients for recovery. There are so many reviews in the literature, like long-term meditation experience is associated with increased cortical thickness of brain. It changes anatomically also. Changes in gray matter after meditation. Negative thoughts, bad moods, and compulsive worrying eventually take a physical residence in our bodies, and that is the cause of the disease. Visualization of healing process over time has been proven to speed up the healing. 1 year meditation intervention in breast cancer and prostate cancer that shows enhanced quality of life, decreased testosterone, altered cortisol, increased immune patterns, decreased mood disturbances, and decreased blood pressure. In a Journal of Integrative Cancer Therapy, study found that women doing meditation experience reduced stress, improved mental health, emotional well-being through the course of therapies, boost body's natural cancer-fighting abilities by increasing the activity of NK cells and T cells. At Stanford University in California, a woman who repressed their emotions show unbalanced cortisol fluctuation, and that can predict early death in women with breast cancer. If a cancer patient is there, then they are emotionally unbalanced, they will definitely have metastasis at an early age. Published in journal called Cancer, there is 88 breast cancers with average age of 55 years, all had experience of significant level of emotional distress. Studied for 3 months, only 3 months study. Telomerase length was similar. In other cases, telomerase reduced. So if longer the telomerase in mitochondria, it will protect us from the disease. Research at National Cancer Institute, body's neuroendocrine response can directly alter the important processes in cells that help protect against the formation of cancer, such as DNA repair and regulation of growth. In another journal, extreme suppression of anger was most commonly identified characteristic of 160 breast cancer patients, and it magnified exposure to physiological stress, thereby increasing the risk. So, extreme suppression of anger. There is evidence that shows that suppressed anger can be a precursor and progression. Reduction in psychological distress in patients with lung cancer, improved mood, and all of those things, that's fine. In breast cancer prevention was found effective in elevating anxiety, depression, decreasing long-term emotional and physical adverse effects with the treatment. And this is done for breast and colorectal, same reducing the anxiety and all. In a neuroblastoma case in children, it could elevate acute pain. In children also, it could reduce acute pain. And coping optimism, it increases the meditation. Meditation influences changes in structural and functional aspects of the brain, which are involved in regulating attention, emotion, and self-awareness. It modulates T1 pro-inflammatory and T2 anti-inflammatory lymphocytes, increased length of telomerase, I told you. These are all summary of the way of literature. Now I will go for some real life stories of people. She is Vienna stable, naturopathy and diet practitioner, developed bone cancer of right leg, was advised amputation. Tried naturopathy, cleansing, diet, visualization, affirmations, not much of recovery. She did deep meditation, commanded her body to heal immediately. Her leg was shrunk on 3 inches, returned to normal immediately in front of her eyes. You can type on Google, see this, her experiences. She was a teacher of theta meditation. She used to teach people how to heal your diseases and she got malignancy. Then she thought that if I am teaching and I am not able to heal myself, then it is not correct. So she sat till she took a pledge that till I am not cured, I will not come out of my place. She started doing deep meditations and she got cured and in front of her eyes, which was shrunken in 3 inches, it increased. Nobody can believe this, right? Louise Hay, you would have heard about her. She has so many books she has written. Self-love is the key. Parents were divorced when she was 1.5-year-old child. She was got raped by a neighbor at age of 5 years. Mental, physical and sexual abuse was a routine in her life. Became unwanted mother at the age of 16. Got divorced. Was a teacher of meditation herself. Diagnosed with vaginal cancer. She cured herself. Still she is there. Daily meditation to heal herself. Daily affirmations before the mirror. Resolve emotional issues. Stopped blaming parents. And vegetarian detoxified diet she took. So moral, disease can be healed if we are willing to change the way we think, believe and act. Just bring this in your mind. Disease can be healed if we are willing to change the way we think, believe, and act. So this if you take from here, you will heal so many people. Another lady is Anita Mozani. She is author of Guide to Me. She has written one more book called Heal. She was diagnosed with cancer in 2002, passed away in 2006. She on table death while doing surgery. Had near death experience. Feel like whole world was just culmination of everyone's thoughts and beliefs. Nothing was actually real. But we make it real with our beliefs. So she felt that her cancer was also not real. She came back to her body within minutes, declared she is cancer free, and within a day, doctors confirmed after doing MRI that there is no cancer mass seen. She understood that how we all are interconnected. Most important lesson she learned was unless I love myself, nothing else in my life can function at its best. We neglect ourselves. My own experience, I had a fracture. We had with the Ranavan IMA, we had a cricket match T20. So that time I was captain of that team, and last over 16 runs we had to make somehow. 138 runs they had done. They did 12 hours match it was. Then last over, what happened? I fell down. There was a stone while taking a run. There was a chance of run out. Then we played with we won finally. That's fine. But I had fracture of 4 toes. So I was on bed for 1 month. Then I never keep quiet. Daily I will be doing some or other thing. So during that 1 month I organized yoga camps and all over Haveli. 31 yoga camps in 30 days we did. Free of cost for everybody. That I was managing sitting at home. And we taught 50 yoga teachers and we called around 15 acharyas in yoga who has experience of at least 20 years in yoga. Then everything was managed. After 2 months, when I was sitting in my OPD, I used to get a shooting pain in my left arm. Suddenly it used to come for a minute or when it comes now, I could not talk, I could not do surgery. It was so severe. Then I was wondering what is the cause, like what happened, why this. Then once my friends had come, we every year we have a meeting on 1 year what we did in meditation. People come from all over the world, we have a meeting. That time I could not go to Bangalore for the meeting, they came here. Then somebody told, you are neglecting your body, I think. Then suddenly it striked that when I was ill for 1 month, I used to have a cordless phone on my right side, right? And I used to lean on this hand. Then I realized for 15 minutes we did a meditation. I asked forgiveness to my hand. I sent vibrations of love to my hand. From that day I did not get any pain. Now also I did not have any pain. You will not believe, I used to take Tramadol daily 4 times. Sometimes injectables I used to take. I mean, it was so severe. Then suddenly from that day it vanished. Where it went, I don't know. But it affects so much self-love. Please say to your body, so much time we walk, our heart never stops in your lifetime. Our lungs never stop even if we fall asleep. Just give gratitude to them. Your eyes always will be seeing. So much of walking you will be doing, your whole foot muscles, how much they will be working. Just tell them some gratitude. That's why I told gratitude is next to the God frequency. God frequency is 986 Hz. Gratitude is 900 Hz. That is the highest level of frequency. If you are continuously in gratitude mode, no problem we will get. We will all have, we will attract those sort of personalities in your life that our life becomes a play, it's a pleasure. So this is Murzani. You can read her books. Another is Martin Brofman, Power of Positive Thinking. Had terminal spinal cord cancer in 1975. How he cured, used consciousness to reprogram his mind during meditation. While eating, he imagined that he is helping in healing the cancer, talked himself positively for 3 times a day, focused his mind sharply on healing by visualization, meditation, and affirmations. He cured himself completely. Spinal cord tumor. How many cases you have seen spinal cord tumor got fully cured? None, I think. Spinal cord is the last gone case. Nothing. She is a lady, motivational speaker, energy medicine specialist, lifestyle therapy. For 18 years she taught. There was a football-sized pelvic tumor. She was 39-year-old, had undergone childhood abuse and domestic violence. She said forgiveness to the parents through meditation. Tumor got softened. Then after 6 weeks, she was free from tumor. So these are all the things, people are there, you can search on the net also. Get yourself convinced so that you can treat. Unless we are not convinced, we will not be able to. First cure your problems, then we'll cure others' problems. It becomes easier. Emotional and mental states play a significant role both in susceptibility to and recovery from all the diseases, including cancer. If the total integrated system of body, mind, and emotions, which constitute the whole person, is not working in a direction of health, then purely physical interventions may not succeed. So, in our practice, we have to include body, mind, and emotions. These are all the other techniques of healing, do meditation. There are so many. Conventional, you can ask your patient to enhance their own healing. Conventional common practice operates on the principle of healing that happens from outside, that is via us and medicines, and that you receive it passively. Instead of this holistic and integrated approach, patient should have a dialogue with their body There should be an intention to it. Besides that, you have to engage actively to heal. Finally, you don't need to rely only on your cognitive abilities alone. You can connect with your higher self and call upon its spiritual resources to enhance the healing process. So when we are dull, like when our mobile phone battery is discharged, we are also getting discharged. So since so many years we have come, human race has come since so many years. There was a pure soul when this all earth started. Then we are all Xerox copies of that. So many Xeroxes of pure, how it will become after so many years. You will not be able to read it. So we are in that position that we lost. We are thinking ourselves as body only and physical being only. But we have forgotten that we are thinking, emotional and feeling beings. What we take from here? Not our body, our karmas. So daily see to it that we have a karma or a plan for this life. Dying empty. If you want to die, everything should be settled and die. One power of now, some book I read, first 2 pages of that book was like, he went to a funeral. It was in a church. There were 4 rooms he has to cross. He saw the dead body. Then he felt himself as he is dead. Then he thought, in first room, his wife and kids were there. So then the Padri asked them to tell about the dead person, 2 words for each level. First room, wife and his kids. What we want to hear from our wife or kids when we are not here. Next room is our relatives. What we want to hear from our relative when they are not. Next room is our friends. What we want to hear from them. Next room is society. What we want to hear from them. Make a list of those things now and plan your life. Take each step daily, accordingly. I tell this as self-audit. I do this since my 10th standard. Whole day, how was it? And next day, how I should improve. Better it. So, I request you put this habit. You will be always happy and at peace. And you will not have any stress. So, health is an optimum state of dynamic equilibrium between energies acting in a different planes of consciousness. Illness is disequilibrium at any plane of the consciousness resulting in disharmony, which can be corrected by moving to a higher plane of consciousness and higher level of harmony. In this, whatever Brahma Kumaris we do, we are self, we are souls, and there is a higher soul also that we are getting connected. Because we have depleted, we need energy from somewhere else, so we are taking the energy to heal ourselves. So, this is concentration. This is our pyramid meditation center at our hospital. There are 7 paths to walk in here. This is magnetic path, mud path, hydro path, gas path, sand path, hydroacupressure path, and herbal path. This is to walk here. 5 minutes walking here is equal to half an hour walking outside. This is done on naturopathic principle. And 80 people can sit here. Any patient who comes waiting for laboratory reports goes to the meditation center and he learns some meditation there. You can have a small room at your hospital whenever they are waiting or admitted patients. Let them have 5 minutes, 10 minutes meditation in a day. You also get involved in that. You will definitely feel the changes in future. And this is Raj Yoga, how we do. Take energy from Supreme Soul to heal ourselves. Okay. Thank you so much. So now, let us close our eyes. Okay, let's concentrate on our breath. Just see that which nostril, just feel which nostril, from which nostril you are breathing now. Is it on the right side or on the left side? Taking breath inside and you are leaving the breath. Without your knowledge, no breath is coming inside and going outside. Just concentrate on your tip of nose for 1 minute. Air is coming. Just go deeper. Just see how you are feeling. Make yourself lighter.